So I'd like to, what can we do to preserve our bone health? So, and maybe we could start with exercise. So if we start with exercise, what is the best kind of exercise that would, so is it, did you have the same kind of use it or lose it? And we talked about, fat, perhaps overweight people walking, so they're using it. Does that same thing apply to bone? And what kind is the best exercise?
It certainly does apply to bone. If you don't use bone, if you're sitting in front of the television all the time, you will begin to lose bone. Because what exercise does is it actually reduces the rate of bone turnover. So it reduces the amount of resorption, the bone resorption that you have. So exercise is very important. Any kind of exercise is important, and the kind that you perform may change with age, because as you get older, you may not be out playing racquetball like I like to do, but you may just rather walk around the block a few times, and that's certainly good too. That's really important. But if you're able to do it, the best kinds of exercises involve some kind of impact. It doesn't have to be a lot of impact, but some kind of impact, because the rate at which you load your bone, which is called a strain rate, goes up when you are loading them in an impactful sort of way. And this has been shown repeatedly, both in children during growth, but also in which you can increase the amount of bone you have when you're a child by doing these impacted exercises, but you can prevent bone loss when you're older, when you're mature, if you do these kinds of exercises. So you don't really add a lot of bone. You may add some bone around the outside of your long bones. It's called periosteal apposition. But mostly in older people, you do exercise to prevent the loss of bone, which will occur otherwise. And so there are simple exercises you can do. I mean, you can jog if you like to jog. I never like to jog. Or you could, you could set up a box that's a foot off of the floor, and you could jump off of it, 36 or 100 times a day. And that would help. That would help your lower extremities. It would probably also help your spine a little bit. But anything that's, involves an impact that way will be helpful. What we also found a number of years ago is that your bone cells, like your brain cells, sometimes get tired. And so if you were to go out and run 5 miles or 10 miles and do this routinely, that may be good for your heart and your cardiovascular health, but it's not going to do it. It's not going to do much more for your bone than if you were to go out and run a half a mile and do that 3 or 4 times a day. When we don't all have the time or the ability to do that, the flexibility to do that, I should say. But after you've loaded the bones at a fairly high level for somewhere between 36 and 360 cycles of loading, so you can imagine each time you take a step, that would be 1 cycle. After about a few hundred of those cycles, your cells begin to not respond anymore to the load. They're not seeing it. So if you stop and wait for 4 hours, and then you go out and do that again, your bone cells will have now become more responsive again. So there's a refractory period. So running 10 miles every other day is not going to help your bones any more than running a half a mile and doing it a couple times a day, or getting a box that's a foot high and jumping off of it, 50 times and doing that 4 times a day in your house and never having to leave your house. So
interesting. Right. So I was going to ask about impact against kind of slow weight, but so does weight training, so I guess where you're putting like a slower strain on your bone, does that help with bones, or you see as impact is the best way?
It can help. I think it doesn't help as much as impact, and it requires a lot more effort. So strain rate is really, which I said is related to impact. The strain rate is actually a combination of of the frequency you do something and the magnitude.
Mm.
Okay, so if you're doing something with a high frequency, like you're doing it very fast, or you're jumping, or you're jogging, or something like that, that's one component. Strain magnitude, which is very high in weightlifting, is the other component. So these two things really combine to determine how your bone is going to respond. So weightlifting it can certainly prevent bone loss, or it can add bone when you're younger. Um, I think it tends to be a little bit less effective, and you have to do a lot more of it because it is low frequency, low impact.
Right. Interesting. So one last question on this. So does your body, is it, I guess, is it area specific? So if I'm running, right, it's hopefully strengthening my leg bones. Does your body go into bone making mode? And so would that help my other bones, or I have to also work on my arms and spine separately?
But unfortunately, you have to work on your arms and other things. But what we found a few years ago, we did an experiment and found that if you are doing an exercise that impacts the legs, actually, some of that will get to the spine. So if you're jogging, some of that will in fact get to the spine. The force is attenuated. So that means that as you go up the body with that kind of an exercise, that the bone will see less and less of the load, but it does see some of the load. Jogging is not going to help your arms much, so you would have to do something else for that.
Right.
And we find this with space flight too. It's interesting because astronauts who go up to the space station for 6 months and then come back, of course, they have a lot of bone loss during that time, even though they're exercising on an exercise device, but because they're in a low gravity situation, they can lose bone. But it turns out that they lose less bone in their arms than they do in some of the other parts of their bodies. And the reason for that is that they're using their arms to do things that they have to do, whereas they're using their legs when they exercise, but other than that, they're floating around and not using these other parts of their body. But they are using their arms because they're doing tasks. And so that is a good demonstration of how important just any kind of activity is to maintaining bone health.
Right. Thank you all for watching. I hope that you found the video informative. Please do hit the thumbs up button, subscribe to our channel, and hit the bell button for new video release notifications. It encourages us to continue to create more videos about anti-aging and extending healthy lifespan. Thank you so much for your kind support. I wish you all well and will speak to you again soon.